Get started. So good morning, everyone. Thank you for joining us for this Medicaid redetermination webinar. I will introduce Emily and Jamie. So Jamie's going to be doing the presentation today, but Emily will still be available as well. So now I will introduce Jamie and Emily, and my name is Sharon Fourcha with IAD. If I haven't already met you folks, thank you for coming again.
All right. So hi, everybody. Thanks, Sharon. My name is Jamie Castelloot. Like she said, I am one of the regional agency managers for WellCare. And then, of course, Emily Lalonde is our other regional agency manager. So we are the managers for Michigan. We're your points of contact for questions. Sharon's been awesome. We work really closely with her. And so we're really excited to, talk to you guys about Medicaid redetermination. And what to expect and how to prepare to help your beneficiaries as we go through this process. So to just jump right in, objectives, just go over what we're going to be talking about again. So we are going to prepare our beneficiaries for this process. We'll evaluate their circumstances related to redetermination because, it can impact their circumstances and their choices. And then lastly, we will identify and guide disenrolled members to alternative coverage. So to go a little overview about Medicaid redetermination, so this is across the country, right? So the population of people enrolled in Medicaid increased by 20% because of the coronavirus pandemic. The public health emergency was put into place and everybody's redetermination was paused. So anybody that was on Medicaid or that status, they were kept at that. Usually every year, redetermination is a normal process, but it was suspended. So now that there is no longer a tie with the redetermination to the public health emergency, we're starting that back up this year. So that's why we're going to start seeing some eligibility changes and trying to just figure out ways to go about that with the members. So across the country, notification of redetermination started to go out as early as February 1st, with those people with a disenrollment possible date of April 1st. Each state is going to set their own date. So today we'll go a little bit later, we'll go in more depth with Michigan, but just keep that in mind that if you do work in other states that you're going to want to check those start dates. So why does this matter? Well, 15 million individuals are at risk right now in losing their coverage. So anyone who is ineligible for Medicaid after redetermination will be disenrolled. These members who are disenrolled will need your help to attain new coverage. So these members, they're going to be scared. They're going to be confused. They're not going to know why this is happening, what's going on. And again, this matters to them. The whole reason we're doing this to help you guys is so that we can help them make this process easy, make them, feel comfortable with talking to their agents and just going through this process as easy as we can. So going into a little more in depth of who will be impacted. So members receiving assistance from their state Medicaid program will be subject to redetermination. Anybody that is going to be on that. So, in Michigan, we have a lot of people on the Healthy Michigan plan, which is state Medicaid. So all these people are going through that. But then you have prospective members, right? That they have limited income and assets and they may qualify for Medicaid, right? And so with this process coming back up, they will go through their eligibility determination process and those people could essentially be eligible for Medicaid. So it's not necessarily going one way or the other. It is coming from a different angle or different angles. So when, like I said, it started early as February 1st, but it's no later than March 31st, 2024. So this is going to be a process that is going to be going on for over a year. Another thing, like when people were hearing about the redetermination process coming up, people were getting worried that it was all going to be happening at once. Every Medicaid person was going to be really evaluated. That's not the case. I don't think that, the systems could handle all of that and whatnot, but this is going to be going on for over a year. So not everybody's going to be impacted right away. We'll talk a little bit later about how to identify those people. Possible outcomes. These beneficiaries who are eligible after redetermination will remain enrolled. So if you have somebody on, if they're in WellCare and they're on, a decent plan and they stay eligible, and they go through all those steps, they will be good. But beneficiaries who don't qualify for Medicaid, they're going to be disenrolled after the deeming period, and they will need other coverage options. Okay, so how does this work, right? So there's difference between the automatic renewal and then request for information. So with the automatic renewal, the state may have sufficient information and the individual may meet Medicaid eligibility, so the renewal will be automatic. So in this case, and I might get ahead of myself a little bit, so you might hear some double stuff, but when somebody is automatically renewed, they have been updating their profile in, I forget what the state website is called, but in their portal with their state Medicaid, they can call in and update that stuff. But if they have, the most up-to-date information on their account and they still meet that Medicaid eligibility, the renewal will be automatic. So if they are eligible, the state will notify beneficiaries that the redetermination is complete and coverage will continue. So they will be notified in that case. Request for information. So the state is going to mail a renewal form and request the required information. So again, this is like how I said, they want, the updated address, income, all that fun stuff. It is time sensitive. And so this, beneficiaries, they need to be looking out for their mail, phone calls, stuff like that. Beneficiaries will be notified by the state agency of the redetermination decision. So if, that case comes back, the state will be the one, or the beneficiaries will be notified by the state. So agents, they may have the opportunity to provide alternative coverage options to those who no longer qualify for Medicaid. So we can talk about that a little bit later too. Member communications. So current Medicaid beneficiaries will receive communications regarding their redetermination from both state Medicaid agencies and WellCare. So first, the state has been going out and identifying those people, communicating, and then WellCare has been going out and identifying those people. So we're reaching out to them through mail, email, we have social media posts, we're texting them. We have the interactive voice messaging for those people. We have recorded messages. So we are trying to touch them in all different points, as well as you guys being the ones to touch them as well. So that is what we are doing on the WellCare side. We're going to talk about loss of Medicaid eligibility. So that deeming period that I said in the beginning, this is a crucial thing that you'll want to understand. So if beneficiaries, if they're on a decent plan and they no longer qualify for Medicaid, they would be disenrolled after the deeming period. So if you work in other states, keep this in mind that for WellCare, every other state aside from Tennessee has a 6-month deeming period. Tennessee has a 3-month deeming period. And so CMS requires plans to provide a member from 30 days up to 6 months for these members to stay on their plan if they lose that coverage. Existing benefits and cost sharing will continue through that deeming period. So if someone in June ends up losing their coverage, they'll have till the end of the year to be on that plan. They will, they'll still receive the same cost sharing and all that stuff. But then after that 6 months, they would lose that. So with that, it does trigger, an SEP, a special enrollment period. So the loss of Medicaid or LAS eligibility status qualifies for a special enrollment period. So the loss SEP starts the month the individual loses Medicaid or LIS eligibility. And then it'll end 3 months from either the date a member is no longer eligible or notified, whichever is later. And that's one thing you will see as you're going through this process too with members. If, it goes a month over and they lost their eligibility, but they weren't notified, that's when you would see that. So let's go over to Alice and get an example from her. So if Alice lost her Medicaid coverage on April 1st, 2023, then her SEP would include April, May, and June to enroll in a non-dual MAPD plan. So she lost her coverage April. She has those 3 months, the month that she started, so April, May, and June. Now, she would still get to stay on the plan for April, May, June, and then July, August, September, 6 months. But you need to have that SEP change within the 3 months because that is the SEP. So that might get a little confusing. They can stay on the plan for 6 months, but they need to have a plan change within the 3 months to have that qualifying SEP. Financial support. So low-income subsidy, LIS, or extra help is available for members with limited income to reduce the costs under the prescription drug program, or Part D. So LIS is administered through the Social Security Administration, and members must meet annual income and resource limits to qualify for LIS. So this members who lose Medicaid eligibility through this redetermination process may still have LIS. So, keep that in mind that when you have, these members who, lose that coverage, they could still have LIS. They would still be really great for our HMO assist plan, which is designed for LIS people. There are other opportunities to keep these members. Just because they lose it doesn't automatically mean that there isn't other options for them. So now we're going to focus a little bit more on Michigan and what that redetermination process is looking like for us. So for Michigan, approximately one third, 3.17 million Michiganders are going through this redetermination process. Renewals for traditional Medicaid and the Healthy Michigan Plan will take place monthly starting in June 2023 and running through May 2024. So June is next month. However, this has been starting way back in March for these June beneficiaries. So we're going to use June as that renewal date as an example. So in March, a member was sent an awareness letter being like, hey, this is coming up. Keep an eye out in the mail for your renewal packet, all that stuff. May comes around, so now they should be getting these renewal packets. They need to have those back in June to have to meet that response timeline. And then if they go through that and they're determined they're no longer eligible, their last date of coverage would be June 30th, 2023. So this is one of the Michigan Department of Health and Human Services communications about the Medicaid renewal. So this is what members will receive. So again, the renewal month is going to be the month an individual's Medicaid eligibility will be reviewed. The awareness letter alerts an individual that a renewal packet will be sent soon. So it will be sent 2 months prior to the renewal month. So like we saw up here, June was the last date of coverage, but the packet started going out, or the awareness started going out in March. And then the last day of coverage is going to be the date coverage ends if the individual is no longer eligible or if the renewal information was not received. One thing to keep in mind about these renewal packets through the state is that they will only be allowed to come in a physical form to that member's address. So you can't go online and download a PDF version of it to have them fill out. This has to come directly from the state to their address. So that's why it's important that they need to have, their information updated, whether, they call in, they update their portal, because that packet needs to be sent directly to them. So how can Michigan Medicaid beneficiaries prepare? This PowerPoint will be sent so you guys can get the links on that. But again, we want to ensure that their addresses, their phone number, their email addresses are up to date. Beneficiaries can also call their local office. So again, on these links, it'll have links to the county office pages, So you can see those numbers, as well as the Michigan Bridges account, which is their portal where they can access all that stuff. And when they go into that portal, they'll be able to see, hey, like this is my renewal date, all that stuff is in there. So I highly encourage you to, if your member needs help with that, to show them how to access that, because it is super helpful. And then 3, just encourage your beneficiaries that when they receive a renewal packet, that to fill it out and return it by the due date with any proof needed. So return by the due date. If it's, if it's in the mail, that's stamped by the time they put it in. So they need to sign that. They need to return the forms. If it's not completed and returned, then they could lose their Medicaid coverage. And that's not good, because, let's say they did have, they were qualifying in some way, but, all this stuff wasn't up to date. That's not good. So we want to be here. We want to get ahead of this. We want to make sure that these beneficiaries are safe, are protected, and we're doing the best that we can to help them. So WellCare support. Member support with WellCare. So this is one of the initiatives that we've taken to kind of help better service you brokers to take some stuff off of your plate. So we have current members, within our decent plans, that we will have a partner, which we call Centauri, to help out with these members reapplying for Medicaid in the Medicare Savings Program. So your members may receive, a letter in the mail. They may receive texts. They may receive calls. But if they, if they're identified as Centauri with WellCare, know that your AOR, your book is safe. They are there to help you with that process. So if a member calls in by chance, or if they call them and they reapply for something, know that you are protected as that broker. So again, just another way that we at WellCare want to help you guys through this process as easy as possible. And then we have our provider support. So WellCare, we are, supporting our providers out in the field to let them know that this, process is coming up. They should already know about this stuff, but when it comes to, specifically WellCare, we want to make sure that we're doing our part in notifying our providers on stuff that they need to know. So they're getting a bunch of communications, they're getting alerts, reminders that Medicaid patients will be going through their eligibility redetermination. So we're sending them flyers, we're sending out postcards, we're sending them emails. Again, just making sure that they can help in the best way that they can, and prepare for maybe any future issues that could arise and get ahead of those. What is the broker's role? So for you all, it's easy. Helpful, proactive, ready, aware. So we want to be helpful. We just want to assist these members with their redetermination changes. These people may not have anybody to turn to. They might not have, grandkids to help them out, with technology, or, whatever the case may be. You may be their only point of contact with something like this. So be helpful, have a proactive mindset. Remember to remind your members, hey, let's make sure your contact information is up to date. You can call with them to the state, make sure they get to the right place, make sure they get that all, make sure they watch for their mail about the state requesting additional documentation, and make sure they respond to any requests for information promptly. Again, this is important. We don't want them to lose the chance that they are going to be eligible or re-eligible for this or through this process. Now, with all of this, you may have already started receiving calls, but be ready. Expect calls from members who are no longer eligible and they need alternative coverage options. Like I said in the beginning, they could be really scared. They could not know what's going on. They need some reassurance. They need some help that, this is a process that this, it is going through the whole country. This is normal. This does typically, before the pandemic, happen every year, so it's okay. So be there for them. Be prepared that you will start getting those calls. And then be aware. Prospects will be subject to eligibility determination. So again, with this starting back up, there may be people who aged in that weren't necessarily, DSNP eligible. And now that they have aged in and they're of Medicare age and they go through this process, they may be at that status where they are DSNP eligible. So keep that in mind with your book or with prospects. that you see out there. So it's not necessarily just impacting current people, current members, but also prospects as well. Just a couple key reminders and resources. So states will vary on redetermination timelines. So like I said, Michigan renewals are beginning in June 2023. So other states may be a little bit different. So just keep that in mind because it will be important for, you know, deadlines and different resources that you may need to go to. So each state will have the date that it begins. Members will be notified. They could have an auto renewal. They could have to send in their updated information via renewal packet, call in. And then after that, if they're deemed ineligible, they have the eligibility to go through an appeal process through that as well. Again, these are more resources, like I said, that you'll get the links to these to take you through those steps. But we have our, you know, redetermination resources through WellCare. Please keep an eye out for your broker bulletin resources emails from WellCare. You know, you get a lot of emails from WellCare. I would say this is probably the one that you want to keep your eye out on the most. There's a lot of very helpful resources in there. And as this redetermination process goes on, we're going to be learning more stuff, right? Not everybody knows what's going to be happening. Maybe there's going to be issues, you know, that arise through the state or whatever the case may be. You know, this is ongoing, everybody's learning. And so, you know, at WellCare, we want to get ahead of that, you know, and so when we hear something, when to communicate that to you all. So when we do have that, you will be notified. So keep an eye out on your emails. And then of course we have, you know, our Ping One sign on workbench portal link. So a couple resources, but of course you can always reach out to Emily or I. We are here to support you guys. If you have or work in other states and you need connections with those WellCare reps in other states, let me know. We can, you know, obviously connect you to those people. We have close relationships with them. But all in all, again, you know, this is going to be happening to so many people, and you just want to be prepared, be aware, and just be there for these people. You know, they're going to need it, and that's what we're here for. So I will finish that off. I know I probably talked a little bit fast, but I really hope you guys found this helpful. So we'll open it up to questions. Feel free to throw stuff in the chat. Sharon, I don't know if you want to jump on or Emily wants to say something, but yeah.
Emily, did you have anything you wanted to add?
I really, you know, with all of that, thank you, Sharon. I don't have too much to add. I think Jamie did a great job of sharing all of this information with you all, but, you know, it's just important to keep a couple things in mind. I think, like Jamie said, there's a number of your beneficiaries that will unfortunately be affected by this, but it's also going to help some members get access to benefits that they haven't been able to access over the past few years as well. So there's positive sides to it as well. One thing that I did want to point out was with the deeming periods, as you can see with WellCare's deeming period, which is 6 months, it is much longer than the SEP that a member gets to change their health plan. I recommend, you know, if you have someone, as Jamie mentioned, who maybe forgot to fill out their paperwork, they didn't return it in time, and that's why they lost their Medicaid, not because they're truly not eligible. This deeming period is a great benefit for them because they have that 6 months to try and regain and reapply for their Medicaid services. If you have somebody whose income has increased, who truly is not eligible for Medicaid any longer, I do not recommend them staying on a plan for the full 6 months of the deeming period. They need to utilize that SEP, which is only going to be those 3 months, to make that plan change and ensure that they have coverage. So I just wanted to touch on that. You know, the deeming period is a fantastic benefit for members to maintain their level of benefits for a period of time while they're trying to regain their Medicaid status. But if you have a member whose, you know, circumstances have changed and they're just not going to be eligible for Medicaid in the future, it's best to use that 3-month SEP to move them off of that plan so they can have a level of coverage that they'll be eligible for and they don't have any gaps in care. But that was really all I wanted to add. Great job, Jamie. Appreciate you doing this today.
Yeah, of course. And again, just thank you, Sharon, for, letting us do this. You know, we're always here for you and for all of your agents and everybody. So, you guys, if you have questions, go through Sharon. She can come through us. Not that you can't talk to us, but that way we can easily answer questions and relay that communication through Sharon. So, yeah.
Absolutely. Thank you to you both for the presentation, and thanks to everyone that joined us. I did enter my email in the chat box if you wanted to check there. If you have any questions, be sure to email me, and then I can email you back my other contact information if you don't already have it. So thank you both, Emily and Jamie, for joining us today to do this presentation. I really appreciate you taking the time. And thank you everyone else for joining us today. And I hope you got some great information, as I'm sure you did. Thank you so much.